Hello, everybody. Welcome to Dental Voice Season 2 with Zyrus. Thank you for joining us. My name is Rolando Mia. The purpose of Dental Voice is to hear directly from professionals in dentistry, get their perspectives, get their opinions, get feedback from them, and most importantly, get some advice from people who've been there and done that regarding topics that are relevant to us today. Our guest today is really cool. Very excited to have him here. It's Dr. David Rice. So Dr. David Rice has talk about all sorts of crazy stuff, and excited to hear kind of his perspective. He graduated from the State University of New York in Buffalo. He's he completed a practice residency Allegheny General Hospital in Pittsburgh. I don't know if anybody folks are from there, but also he's huge about education. Was with the Pankey Institute, Dawson Center, Spear Center. He's participated as a professor at SUNY Lab, and then I think he acquired a practice about 20 plus years ago, that's evolved, and then also the founder, the creator of Ignite Dental. So Dr. Dave Rice, good morning, and hey, how are you doing?
I'm great. How are you today?
Very well, thanks. Thank you for joining.
You bet.
By the way, especially on this day, oh shoot, I keep pointing to the wrong thing. So if you would please, it's one of the things that I'm excited about to talk to you today is the whole context of dentistry and how it's evolving, and more specifically, how dentistry right now is transitioning. I'm going to call it transitioning to a younger generation of dentists. And if I understand correctly, Ignite Dental has a very high focus on that. Could you kind of give a context behind how that kind of came about, and where the genesis and the energy for that came from?
Sure. So I've always taught in some way, shape, or form from the time I finished my residency program to my very first day in practice. I've always taught. I used to teach a day a week at Buffalo's dental school, and I loved it. And then I thought, wouldn't it be cool to teach around the country? And I spoke at trade shows. I still do the Greater New York and Yankees and Chicago's and all that fun stuff. But my favorite people in dentistry are young people. They're people who still have everything out in front. And I always thought it'd be really cool to help people build kind of a new house well, than try to fix an old broken house. And sometimes dentists my age and older, sometimes we think we know everything. Hopefully most don't. But I got energized working with young dentists, with dental students, and hence, 9 years ago, Ignite DDS was born, and I love traveling around when I can, and today more virtually than ever, working with students and young dentists. It's a lot of fun.
That is so awesome. It's interesting. I don't know if you've heard this. We don't know what we don't know, but we know what we know. So we think we know, therefore we just know, and no one can tell us otherwise, right?
Such a true story.
So when it comes to dentists, young dentists, the whole COVID-19 environment and this pandemic has really kind of, and what we've been hearing is it's an accelerator for a lot of different things. It's an accelerator for some of the older dentists to finally transition out. It's an accelerator forcing young dentists to jump in and have to do a lot more, that type of stuff. From what you've seen working with young dentists or dentists who are entering, what are some of the top things that they're experiencing, especially I'm going to call it the millennial mindset, as opposed to the boomer mindset, or the older, not that the older, the more mature dentist. What would you say about that?
Yeah, I think generationally, the biggest shift I see is boomers, they live to work. And the more seasoned dentists that I know, they're almost defined by dentistry. We have an incredible prosthodontist in our practice, Marshall Fagan. Marshall's amazing, and I admire him because still today he's in his 70s, and he comes to the practice and he's as excited as he was the day he walked across graduation stage. But that's a like live to work. And I think today's mindset is we work to live. So dentistry is very important. Our business life is very important, but there's more of a merging of life. There maybe necessarily isn't a hard I get up, I go to work, and then I do my own life. It's sort of this one big, all right, I'm gonna do this on purpose, amalgamation of life, but it's working to live. So there's better balance, I think, today than even for a guy like me who, largely defined his life by profession.
What a distinction. Live to work versus work to live. Holy cow. I can totally resonate that. When younger professionals are entering, their mode of communication is very different. Their use of technology is completely different. Their method for engaging is completely different. What are some of the things that you've seen? And from an experiential perspective, what can you share with people watching this about things to be mindful of as they're kind of navigating through their day?
Okay, can I frame it first? Is that okay?
Absolutely, please.
All right. So, mom and dad didn't mean to do this to any of us, but I guarantee all of our parents taught us the golden rule, right? Treat others the way you want to be treated. And I would argue that that may be one of your parents' biggest mistakes. And they didn't mean it to be a big mistake. What they really meant is be nice to other people because you like it when people are nice to you. But I think today more than ever, we've got traditionalists, boomers, Gen X, Gen Y, and now Gen Z are sometimes working in the same building, yet alone coming in and out as patients. And to your point, yeah, we all communicate entirely differently. And I would say scrap the golden rule and implement the platinum rule. Treat people the way they want to be treated. Because I guarantee you, Marshall at 74 wants to be treated very differently than I do at 51, and maybe you do if you're 25. And communicate, to your point, communication is a really simple one. Some people want a phone call, some want an email, some want a text, some want a message on some other platform. And that's just one tiny little example where we think we're doing the right thing, and maybe we're totally miscommunicating.
Holy cow. That is, you know, you're, hold on, I'm of your generation, the golden rule. But in considering what you just said there, the significance of that is incredible. Treat people the way they want to be treated. Communicate to them the way they want to be communicated, not the way I do it. Is that kind of what I got?
It's 100% it. And again, I think the golden rule comes from a really good place, right? It comes from here.
Right.
But the reality of it is it's inherently flawed because we each want something different. And age, generation, that's just one factor. Human behavior at large is a factor. Culture is a factor. Family, firstborn children versus the youngest child or the middle child, gender, like so many things come into play that if I'm a dentist today or a dental team member today, like my number one learn outside of technology that makes dentistry safe and convenient is how to best communicate with my patients.
Phenomenal. Communication has systemically or consistently, let me put it that way, bubbled up to be one of the absolute most important aspects for dental professionals during this pandemic. And it's interesting. We've on Dental Voice, we've spoken to quite a few, and it's an incredible range of people in all sorts of different functions, but consistently communication has been the biggest aspect of it. From a young dentist, from what you've been seeing, how do you see what's the advice that you would give people with regard to implementing that? It's easy to say, talk to them the way they want to be talked to. Oh, okay, yeah. But how do you do that?
A long time ago, one of my mentors told me, fair, firm, and friendly. And he was always David, fair, firm, and friendly. So I've sort of morphed that today. Be kind, be clear. You have to set expectations and then be consistent. Because when we set expectations and then we don't follow through as the leader, young dentist, I know you're walking into a practice and whether you're an associate or you're a new owner, everybody's been there longer than you have. It's okay. That team, they're still looking to you. Whether you're an employee, an associate, an owner, you're still a de facto leader, whether you want to be or not.
Right.
So, be kind, let people know that you're open, ask great questions, be more interested in them than interesting, and then be clear with your direction and then really, really be consistent.
That's amazing. Be consistent, be kind. So you touched on leadership. One of the things that we were learning working with dental schools is that there's a lot of great information. Operatively, it's starting to come in. From a business perspective, dental schools are starting to add some of that. But this whole idea of leadership, especially, and you hit it right on the nose, in a pandemic, in a crisis, people look to somebody to help or make decisions or make a call. What can dentists, and we're not just talking young dentists, because we're seeing some of the more, dentists who've been around for a while struggling with this. How do you establish that leadership mindset and make decisions when you don't know the answer?
I love that. I think right now, if you flip a switch and say, hey, this isn't we're not necessarily in a pandemic as a problem, but we're in a pandemic as an opportunity. What we know is our teams and our patients, like, number one emotional concern is their safety. They need to feel safe, whether we work together all day long because they have kids, moms, dads, whomever at home themselves, or patients coming in and out. So I would key on the fact that your team in this instance, like, they want to feel safe. So just ask them how they're feeling, what you can do as the leader to get them in the best place possible, and then consistency, follow through, and check in every day. How are you? And be specific with each team member, because everybody's different. Everybody's going to look at safety through a different lens. So customize your conversation based on, who's in front of you, and follow through.
Follow through. That's a great, that again, boom, follow through, because so many things are happening during the course of the day. Patients are coming in, you're worried about this. You say you're going to do things, and then you become derailed or you become distracted. So follow through. That's fantastic. I love that. There's a mindset right now that, patience. It's about patience, but there's a fear that they're having around potentially coming into the practices. We spoke briefly, according to the ADA, although dental practices are open right now, the majority of them are only tracking at, maybe 3/4, 80% of where they were before. And this is causing a lot of distress and stress. How's your practice doing, and how do you kind of overcome the fact that, oh crap, patients are coming in?
So very thankfully, we're doing great. We're actually doing far better than we were pre-COVID. And I think what it is, honestly, we've always had a great foundation. We've always had a great reputation in our community, and we've always had a practice that grew year in and year out. But what's happening now is, because we're asking those questions of our team, because we are being clear, we are being consistent, our teams and our patients feel really, really safe. And I'm going to caveat this. I am not a patient-centric practice. Never have been.
You're part of East Amherst Dental Center, is that correct?
Yeah, I'm a firm believer in that. If you and I, team dentists, if we take care of our teams will take care of our patients. We have a culture where our teams love coming to work every day. They feel like they're a part of something bigger. Our patients feel it. You guys know this when you've gone to visit somebody's house and you knock on the door, you ring the doorbell, and like the vibe is really good. You're super excited, or you ring the doorbell and you're like, something's off, and you just kind of can't wait for that evening to be over with. Yeah. It's the same in business, right? Patients walk in the door and they immediately feel good, or they immediately think, I've got an hour. to get out of here, and I'm just focused on getting out of here. So take care of your team first. If safety is a big issue, just dot all your I's and cross all your T's. So get that virtual reception area going. Talk to your patients while they're still in their car. Do the forehead scan, ask all the questions, do things. I mean, we've done this all the time, but if you're not, I'm an Isolate fan. I'll give you an example. We have one in every treatment room in our practice. We have for years. But you want to talk about feeling safe as a team and the ability to cut down aerosol. My team feels good, especially my hygiene team, right? Which we know is a massive problem in dentistry today, right? We've got 80% of hygienists who are like, I don't really know if I love dentistry anymore. But we've got 4 hygiene members on our team, and they feel great. So our patients feel great. So just do those things that make people know that they're in the best hands when they're with you.
That's so cool. Do that thing that make people feel. And is that what, because of the clarity, because of the communication, patients are not, are you discovering that patients are not apprehensive, or if they do come, they realize, wow, I love that context around you go in and it feels good, or it doesn't feel right. So are you seeing patients feeling more comfortable? Are they expressing that to you?
They are. It was really interesting at the beginning of all this. Our patients, they weren't angry by any stretch of the means, but they were like, when can we come back? We're not worried. You've always taken great care of us. We just like to come in now. So for us, it was the work we did, years ago. If you're that practice, awesome, keep sprinting. And if you haven't been that practice in the past, who cares? Now's your chance. Now's your chance to level up your game and be that practice today, because your team and your patients, they're just waiting for you to do it. There's simple steps. It's not like big, gigantic monument. You don't need to go buy a $300,000 piece of technology. You just need to utilize all the tools that you have at the highest level.
Wow. Wow. Thank you for that. Wow. So you mentioned, and I want to touch on this in our discussions, and it just recently came up. We spoke with Melissa Turner yesterday, and we've spoken to other hygienists out there. Although there are practices where hygiene and the dentist get along really well, there's still a lot of friction between that, because of, I think, it's kind of a miscommunication maybe, or it's not seeing the same kind of thing, and there isn't that meshing. How do you, or what advice or opinions do you have regarding, one, how to navigate into that discussion, and then overcome it so that there's a meeting of the minds and people are able, hygienists and dentists are able to kind of come to a recognition that we need each other?
Yeah, I would do a few things. If you've never really sat down with your team and had a serious meeting before, then I wouldn't jump right in. The first thing I would do, step 1, would be identify the people on your team that everybody listens to already. You have inherent leaders as teammates. They could be a hygienist, could be an assistant, could be on the business team, but identify who those people are and sit down with them. Because if you can get them on your side, if you can share the vision with those 1, 2, 3 people on your team, it's gonna be a whole lot easier for you to share it with the rest of your team. If you already done this before, then block out an hour. Don't block it out around lunch or breakfast, because people be distracted, but block out an hour of your time during the day, pay your team for the hour, and sit down and talk about how they matter more to you than everything else. Set the tone, and then talk about all the things you feel are the right things to do, and ask their opinion and for their help. And then by the end of that hour, come to a consensus that everybody feels comfortable with, and as a united front, move forward. That's what I would do if I were you guys.
Wow. Wow. I love the context around, don't just, so here I am, I'm the dentist, I've been there forever, I've never really done it, all set aside. Great, everybody come in. I can totally see how that would just cause, wait a minute, you've never done this. What's going on?
Yeah.
And it gets freaky, and then people are like, whoa, what's up?
Yeah. So if it's new to you, take some baby steps before you take a big giant step. And if you've done it before, then do it again. Just stay focused. Don't derail and talk about all the things you don't need to talk about. Stay focused.
See that it requires courage and it requires confidence to kind of overcome that. When you
Yeah.
look at the clinical skills and you look at the education and training and the context of that, dentists are clinicians and they love doing that. How do you get that? I'm going to call it that mentoring or that coaching or that. How do you find that? Because one of the most difficult things for people to deal with is people, because people are people, right? So what advice would you give people who are in the midst of that? They're in practices that may be struggling, and not only is the pandemic, practice isn't doing quite as well, and there are definitely pressures and all that. Where do you find that? How would you do that?
So I'll preface this with there are lots of really good people in dentistry that are mentors. So there's no one guru. That being said, I'm not sure how you guys will take this, but I'll say unselfishly on my part, but may come across selfishly, but come to Ignite University. Send me an email, send me a text, drop me a message. We have a half a dozen courses that are all about leadership, culture, communication between us and our team, us and all of us and our patients. And I'll tell you, for every dollar I've spent at Pankey Spear Dawson over the years, AACD, I've spent $2 on learning how to be a better leader and communicator, because dental school didn't teach us that.
Right.
Right. And we need mentors. I wouldn't recommend trying to read it in a book. I wouldn't recommend, I know we're broadcasting on social media. It's not a lesson to learn on social media. All you're going to line up 10 people and get 10 opinions. And you need to work with things that are founded in science and logic, that are repeatable, not just random Tuesday morning. This makes sense.
That totally makes sense. And here's the thing. Part of what got me connected with you, excuse me, is people have mentioned you, people have mentioned Ignite. And I think it's important to recognize that. And I appreciate you bringing that up. So not a problem there. Are there other technologies that you've run into? And again, you mentioned isolitis in your practice.
Mm-hmm.
Was that something difficult for you to adopt, or how did you end up there? I'm just kind of curious.
Gosh, I don't recall how many years ago, but it's been a while that we've been using it. It was super simple to adopt. In fact, I still remember Holly in our practice. I remember the day. So Holly's hooking it up in our room, and I walked in, everything was ready to go. Patient, numb. By the time I sat in my seat, everything was ready to roll. And I just looked at Holly. I'm like, didn't you just hook that up? She's like, yeah, it took about 2 minutes. And we just ran. And it was great. And it was so great that we outfitted all of our restorative treatment rooms. So I needed to set up my partner, Mark, Laura, Marshall. And then we said, this is crazy. We like in hygiene, just as an example, we do sealants out of hygiene, but we always needed an assistant to go over there because it was really difficult to maintain isolation and do a great job. So we're like, oh, let's get them for hygiene. And now we find our hygiene team, like, they use them for everything. It's, the saliva ejector isn't hanging out of the patient's mouth anymore. It just goes in, they get one side, they flip it, they do the other side. And our hygiene team loves it. Our assisting team loves it. And now, I'm telling you, I love it for a totally different reason than many of you are thinking. It's a tremendous device to isolate and to create a field of vision for us. But why I really love it restoratively is when Holly and I work together now, it's not that Holly isn't still aspirating, she is, but she's a second set of eyes, and she sees things from her side of the chair. And we have a really nice relationship where Holly would be like, you know what, Dave, take a look at the distal lingual of whatever while you're doing what you're doing. I'm like, oh, that's my cue, like numbskull. You didn't see what you needed to see. And, it's not my job as a dentist to be like, Holly. My job is to be like, oh my God, Holly, thank you so much. Because I'm so much better with her than I am by myself. So it's a tremendous adjunct, not just in isolating, but in developing better dentistry from a teamwork standpoint and a vision standpoint.
I really appreciate. Are there other, and I really appreciate the context, and especially the dynamic that you and Holly, your dental assistant, have kind of generated. You're better together. That's a fantastic. Again, the things that you're saying. Are there other technologies that you've discovered that are really really powerful in the dental practice, or systems that you would say, hey, folks, if you're out there, these are important?
Yes, I would say if you're not scanning in dentistry today, if you're still making a lot of physical impressions, I would highly recommend you start scanning. There's a ton of data to show what patients want. They want us to be convenient. They want us to have great Google reviews. They want us to accept their dental insurance. We don't have to participate. You could, but they want us to accept it. And they want technology. So scanning is, to me, such a leverageable piece of technology. Now, I also like to mill 60% of the restorations in my practice, in addition to scanning. That's up to you in your treatment philosophy. But that's a must-have today, from a delivering clinical excellence to internal marketing to your patients, to being convenient, having the tech, getting better Google reviews, and on and on. It checks 3 of the 4 boxes.
Cool. Oh, that is really cool. The digital revolution, technology, all of that is phenomenal, and
Yeah.
it's only enhancing everything, which is really cool. Also, I meant to say it before, learn directly from people. Don't try to learn on YouTube or these types of things. These are great ways to get introduced to concepts, but go reach out, which I believe is really powerful.
Totally agree.
If you were to look at dentistry, and if you were to look at COVID, it's not going anywhere. It's here. How do you see that affecting it going forward? And what are the things that people need to consider with this, call it an accelerator in place now? Plus, we don't know what's in the future, so it's crazy to get wigged out about that. But what advice would you give people with regard to dentistry going forward and the effect that COVID has had on everybody?
The number one thing, and not to sound too philosophical, but see the opportunity. We get to actually slow down, from the rat race that dentistry has kind of steadily become over the years, but we get to slow down. Bring virtual into your practice. So if you are doing virtual consults with patients at home, awesome. Add virtual to your hygiene checks. I can do a hygiene exam from my treatment room, computer to computer, talk to a patient, the whole 9 yards. It's incredible. Same day dentistry, really important. So you may have a lower volume of people coming in your front door, but if you pay attention to your schedule in advance, you might be able to take me from the hygiene chair and bring me to the restorative chair, or the restorative chair and bring me to the hygiene chair. Or now you have a built-in, hey, David, you're here. So instead of working on that one tooth, I know you don't want to come back. I know you missed a lot of work. I know your kids missed school. I know time away. I know safety. Let's get as much done today as we possibly can. And your patients will say yes. They're waiting for you to make that suggestion. So look for the opportunities that we have today instead of getting, down all the time, and lean on each other, because you're not always going to be happy and excited. So when you're having a bad day, have somebody else on the team pick you up.
That is so cool. As a matter of fact, can you see on one of my centrals, I split? No, I'm joking. So, first of all, there's so many topics that I could really spend some time and dig in with you, and want to be respectful of your time. And I would love to get into some of these other aspects later on. From a message, from a sentiment for young dentists, for all dentists right now, and when you're looking at COVID, when you're looking at kind of the uncertainties that it's facing for us, and the fact that cases are going back up. They're talking about possibly shutting down. The election is going to put a big effect on us. There's so many different variables here. How would you kind of sum up everything that we talked about as a way to bring it together and kind of inspire people going forward from here? What would you want to say to dentists, to their teams, to patients right now? What sentiment would you like to get across?
If I could leave you with one giant umbrella message as a leader, it's to be vulnerable. So I'm not sure how many of you saw Brene Brown. This is a few years old now, but if you haven't seen Brene Brown speak, she is someone to go to YouTube and watch her TED Talk. She's brilliant. Everything she speaks on is founded in data. Yes. So it's not just an emotion. It'll be a very emotional experience for you, but it's very scientifically founded, which is why I like it. But be vulnerable as a leader. To your point, Rolando, we don't have the answers. We're not going to have the answers. So look in the mirror and know that it's okay to not have the answers. It's okay to share with your team that you don't have the answers. You're going to make mistakes. Be okay with making those mistakes and just shift, pivot, adapt. The practices, the leaders that evolve with COVID and whatever comes after COVID, because this isn't the last thing that's going to come our way.
Right.
Those will be the most successful people and practices. And I'm not even saying successes in this. I think successes in what brings you joy. Right. And money help makes life easier, but what brings you joy. So be vulnerable.
Awesome. Thank you. Thank you for that. If people wanted to get in contact with you or ask you questions, what would be the best way to do that?
So I'll give you two ways. Both are simple for me. So whatever's easiest for you, you can either email me, david.rice@ignitedds.com. Simple. Or if you want to just go to Instagram or Facebook, it's @ignitedds and send me a message. I'm always happy to help. Dentistry's been really great to me. And I honestly want it to be great for you too.
Cool. And Ignite Dental, if people had more questions about that, same place, or is there a website people go to?
Yeah, you can go to ignitedds.com, easy to find. You can also message me through our website, but yes, just reach out in whatever way is easiest for you to reach out, and someone on my team or myself, I'll always get back to you within about 48 hours. Someone on my team will get back to you within the first 4 hours.
Excellent. Well, first of all, I so appreciate you taking the time to spend with us today. I love the message that you give across. There's a calmness to you, which is interesting because there's an intensity to what you're saying, but the way you deliver it is, I hear it. I can hear it. I'm not just listening, I can hear it, and I very much appreciate that. So thank you for that, and really appreciate it. I've actually learned a couple things, and I love it when I learn, and I think that's fantastic. So thank you for that. And plus, you got a lot more of this than I do. So I'm like, wait a minute, how long have you been in practice? What's up with that? So hey, folks, those of you who are going to see this, if you have any questions for Dr. David Rice, please reach out to him, check out Ignite Dental, send him messages. If you have questions for Zyrus or anything that we do, or want to hear more from people and our guests, please let us know. If you like the content of this, please share it. If you have any questions, please reach out to us. Thank you so much for being with us. Thank you for taking the time. Thank you for sharing your expertise, your wisdom. It's funny, education, experience, knowledge, wisdom. You have education, experience, you build the two together. With those, you build knowledge, but time gives you the wisdom, and you got all of those. So really appreciate that. Thank you so much. Please be safe. Sometime later down the road, would you like to join us again and kind of see how things are going? Would you be up for doing that?
Absolutely.
Awesome. Thank you so much. Take care, and we'll be talking soon.
Take care.